Hello everyone, this is Michelle Lopez and I'll be your instructor for Nursing 213 this fall. I'm looking forward to working with you. This is our student class preparation. Every week I'll make an introductory lecture for you and we'll go over some of the highlights so you can get a good foundation for what we'll discuss when we come into class on lecture on Thursday. So for week 1, we are going to discuss immune disorders. Some of the immune disorders that we'll develop in class will be the allergic disorders. We'll talk about anaphylaxis. We'll talk about transfusion reactions and transplant rejection. We also have a lot of groundwork to do with SIRS and sepsis, septic shock, HIV and AIDS, and lupus. In fact, with AIDS, HIV and AIDS, we actually have a guest speaker coming in to our class for week 2. So I'm looking forward to having that experience with us in class. So some medications or classes of medications that you'll be responsible for week 1 will include your corticosteroids and NSAIDs, epinephrine and antihistamines, vasopressors and bronchodilators. So make sure you read up on these meds or classifications in order for the best preparation for our class discussions. These page numbers and chapters are listed in Lenny. And then there's also some of the basic information in our IGGI textbook. Okay, so it's important for us to know that in class we'll go over some basics of the A and P of the immune system and some deeper understanding of the patho regarding some of these illnesses and disease processes. However, it is important for you to read your chapters that are assigned for each week so you can come into class with a fair shot of getting the most out of the content discussed. It's essential that you appreciate that these lectures will give us foundational information so we can jump into developing what the nurse will do. Our emphasis will be nursing management of these types of illnesses and disease processes, for the patients that we're taking care of. So with that being said, here's some background information into allergic disorders. So allergic disorders, they can result in a varied hypersensitive reactions to allergens depending on how the tissue is affected. So there's different types of reactions. So for example, a type 1 allergic reaction, an example could be allergic rhinitis or urticaria, angioedema. Type 1 reactions occur when a client is exposed to a specific antigen. Those antigens, examples could be pollen, mold, medications, or food. Now, allergic rhinitis, that's hay fever. That causes nasal congestion, sneezing and itching and headache. Whereas urticaria, that's raised red skin wheals that are pruritic. They usually appear on the trunk. And angioedema, that's actually painless swelling of the subcutaneous skin layers and mucous membranes. So think about that as basic information, like foundational information, and then in class we have to develop what our nursing management would be. Okay, that's the focus. That's how you should think about how to approach these pre-lectures. So let's carry on. Let's do type 2 reactions. Type 2 reactions, such as a transfusion reaction, these type of reactions result from cell destruction. Type 3 reactions such as responses to meds, common meds like penicillin or sulfonamides. They are local reactions that change several hours after exposure. And type 4 reactions, such as contact dermatitis and transplant rejection, these are delayed responses to an allergen. So keep this in mind. When we're in class on Thursday, we'll have to develop what is actually happening in the body. That could help us with appreciating these situations. And then what's our nursing and therapeutic management of these situations? For example, medical management of clients who have allergic responses includes, first of all, identification of causative factors. And then we also have prescribed meds to treat the symptoms. And we have immunotherapy treatment. Now, this is an important factor here. Nursing care will focus on helping our clients identify factors that lead to the reaction, and also ways to avoid exposure to allergens, and also reinforcing the prescribed treatment. That's really important. So now let's discuss anaphylaxis. Anaphylaxis is a potentially life-threatening type 1 systemic reaction to allergens. Now, patients who are extremely sensitive to a particular allergen, and those examples could be shellfish or chocolate, antibiotics, and certain types of nuts, these patients can suddenly develop symptoms such as flushing, nasal and throat congestion, severe dyspnea, and this can lead to respiratory failure and severe hypotension and death. So, the medical management of patients who have anaphylactic reactions, it's going to be directed towards life-supporting measures, and that's going to be maintaining the airway and administering IV fluids and specific meds like epinephrine, antihistamines, vasopressors, and bronchodilators. Now in class, we'll develop this more about the nursing care, because we should be focused on identifying symptoms and monitoring vital signs and continually assessing cardiovascular and respiratory status. We're also going to be responsible for the emergency treatment delivery and obviously helping the patient learn how to identify causative allergens and also how to prevent subsequent reactions. Now, transfusion reactions will occur when clients require replacement of homologous blood components. Reactions can actually be classified as febrile, non-hemolytic, allergic, urticarial, delayed hemolytic, acute hemolytic, or anaphylactic. Now, the most common is the febrile non-hemolytic reaction. And this type of reaction occurs in people who've had previous blood transfusions. Now, the symptoms to look for include fever, chills, nausea and headache, hypotension, and respiratory problems. Now, some background regarding the medical management is going to be dependent upon the type of reaction, and also focuses on including stopping the transfusion and treating symptoms with antihistamines and corticosteroids. Delayed hemolytic reactions, they're usually undetected and untreated. Now, emergency treatment is initiated for acute hemolytic and anaphylactic reactions. And our job in class, we're going to pull apart the emphasis of the nursing care here. Regarding transfusion reactions, your nursing care is going to include a careful, detailed assessment, a baseline assessment, and we're going to be doing vital signs prior to transfusion, and ensuring that the client's blood type has been typed and cross-matched and that everything jives, and that the schedule of the transfusion and that of the scheduled transfusion product with another nurse, meaning that you have to verify with other nurses before we initiate the transfusion. The nurse is also responsible for monitoring the client for any signs of transfusion reaction, and the nurse must stop the transfusion if a reaction occurs. So be prepared for this, read it over in your textbook, be prepared for discussion on what are transfusion reactions and what do we do to prevent and what do we do to manage if unfortunate circumstance like this happens. Okay, so the next topic we'll discuss is transplant rejection. Now, transplant rejection is a potential reaction to any organ transplant. That's any substance that the body recognizes that it's not its own. So bone marrow, corneal transplants, organs such as heart and liver. Now, despite careful matching of the donor and recipient tissue and administration of prescribed immunosuppressant medications, these situations can arise. Manifestations of tissue rejection include fever and weight gain, edema, or even tenderness at the transplant site. And when we discuss this in class, we'll emphasize the nursing care of clients who undergo organ transplant and direct our focus on assisting the patient and the family to deal with concerns about the procedure and monitoring the patient for rejection. Things like the changes in vital signs and their changes in their nutritional status. Their mental status can start to decline, become very clouded, and also a change in fluid balance. This can happen following the transplant. Our nursing care must appreciate that clients must also be instructed about symptoms of rejection and the importance of preventing infection. Now, in class, we're going to talk about specific illnesses and disease processes. We don't do every single one in our textbook in a specific order. We cover specific ones. So for week 1, we are going to talk about lupus. Lupus is classified as an autoimmune disease. There are other autoimmune diseases that perhaps you've covered in previous courses, such as rheumatoid arthritis. Myasthenia gravis is going to be covered in Nursing 216. But here, let's give some background about lupus. So first of all, systemic lupus erythematosus, or SLE. SLE is a chronic, progressive autoimmune disease. That means that the body is attacking itself. And this autoimmune disease involves multiple body organs. And interesting to note that lupus most commonly or frequently affects women of childbearing age. Lupus is also a disease of exacerbation and remissions. So that means there's good days and bad days, or good blocks of time and bad blocks of time. Now with lupus, immune complexes are formed as a result of antibody production, and that causes inflammation and tissue damage. And this tissue damage can be extensive. It's basically anywhere in the body. Lupus, some common areas though are the skin, the brain, kidney, lung and heart, and joints. Now, lupus manifests as, or symptoms rather, can include pain and joint swelling. People can present with fever, frequent respiratory and cardiac infections. And then there's this classic butterfly rash. I'll show you some pictures of this during class. There's also a picture in your textbook too. Now, medical management of people with lupus will focus on decreasing tissue inflammation and destruction. And we'll also focus on monitoring for any damage to cardiac and neurologic and renal and pulmonary and hematologic systems. Now it's important to note that NSAIDs are prescribed for muscle and joint pain, and corticosteroids, they're also used for immunosuppression. There's other meds too, and we can identify some of them in class. Be prepared for class to discuss the nursing management of patients with lupus. And that nursing care, just to give you some background, will include assessing the client for symptoms, teaching clients about the condition, and how to maintain skin integrity, and also how to use stress management techniques. Stress can be associated with these periods of exacerbation. With lupus, we also have to teach about lifestyle choices, and it's very important to understand the medication regimen. And nursing will also try to help patients so that they can be encouraged to report additional symptoms. And it's also essential to keep their scheduled appointments with their primary care physicians, and they also have other specialists. Okay, so for our lecture on Thursday, HIV and AIDS will also be discussed and further developed. It's essential that we walk away on Thursday with a good understanding of HIV and AIDS. As I said earlier, we will have a guest speaker in our class on week 2. It would be important if you could, brainstorm questions that you would like to ask someone who has HIV. I think it's important for us as empathetic and compassionate, educated healthcare providers to get some kind of background on what it actually means to live with certain illnesses and disease processes. Will give us some insight on how we can direct our care. So think about what kind of questions you'd like to ask someone. We have a very interactive presentation next week, so that would be a good starting point for us. So with that being said, let's give a little background on HIV and AIDS. Now, AIDS, acquired immunodeficiency syndrome, this is a progressively fatal disease caused by the HIV virus, the human immunodeficiency virus. And this virus destroys the body's immune system and its ability to fight infection. So, AIDS, some highlights: a disease of inadequate immunological response by the body. AIDS, HIV, is a major international health problem. You must understand this. The incubation period is said to be 2 to 4 weeks following exposure to the HIV virus, after which some people develop flu-like symptoms, and those can be fever, sweats, headache, myalgia, neuralgia. People complain of sore throat, GI distress, and photophobia. And these flu-like symptoms, they can come on quickly and they can disappear in several weeks. Most people, it's said, remains symptom-free for many years. However, others develop symptoms within a few months. These symptoms include enlarged lymph nodes, weight loss, fever and sweats, lack of energy, persistent skin rash or flaky skin, frequent oral or vaginal yeast infections, that's a red flag also, and then herpes infections. Now, HIV infection can be transmitted via blood, semen, vaginal secretions, and breast milk. Now, high-risk behaviors are associated with the spread of HIV, and those include engaging in unprotected sexual intercourse, having multiple sex partners, withholding information about HIV status, and sharing needles or syringes. There's also high prevalence among men having sex with men. Let's see here. What else can I tell you? Important to note too, transmission of HIV to healthcare professionals is possible, but we have standard precautions, universal precautions outlined by the CDC and OSHA, so that has helped with reducing the healthcare transmission, but still it is a big risk for us. We'll talk more about that in class. Now, regarding the medical management of HIV and AIDS, people who have HIV or AIDS focus on minimizing disease progression, essentially by keeping the viral load as low as possible for as long as possible. Now, drug therapy is initiated when clients, including clients who are HIV positive but asymptomatic, exhibit antibody formation. That's called seroconversion. Now, there's combinations of meds that can be prescribed over the course of illness. We can identify some of those in class. A number of opportunistic infections are also associated with advanced HIV disease, and they can go throughout all the systems. They include illnesses of the respiratory system, things like pneumocystis carinii, pneumonia, that's PCP. There's histoplasmosis and tuberculosis. There's illnesses of the GI system. Let's see, there's hepatitis, HIV wasting. There's oral cavity issues like candidiasis or oral hairy leukoplakia. And then there's gynecological issues such as vaginal candidiasis. The gamut of infections can arise. And then there's the opportunistic malignancies such as Kaposi's sarcoma, and non-Hodgkin's lymphoma can also develop. We will pull apart the nursing care and management of the patients with HIV and AIDS. We're going to go through stages of the infection. So HIV positive patients should be encouraged to limit high-risk behaviors such as unprotected sex. For patients who develop AIDS, nursing will provide support in adjusting to the diagnosis and help the client understand the prescribed therapeutic regimen, and encourage follow-up with healthcare professionals. Nursing will also help patients recognize symptoms of opportunistic infections for which the client is at great risk. And nursing will also assist with home care or hospice arrangements as the disease progresses. We have an extensive case study that we'll do in class that can help pull in these key pieces of the management of HIV and AIDS for you. Make sure you read about HIV and AIDS, the patho, and what happens in the body and what happens when during the different stages of HIV and AIDS. And then this way we can deliver the appropriate nursing care. Okay, so sorry about that previous slide. I went over SIRS. A little bit of background about SIRS. So SIRS it's systemic inflammatory response syndrome. The introduction of SIRS was intended to define a clinical response to a non-specific insult, and that insult could be infectious or maybe not infectious. So in order to be classified as someone with SIRS, 2 or more of the following need to be present. So that would be temperature changes, as you could see here, less than 96.8 or greater than 100.4 degrees Fahrenheit. If a person has a heart rate greater than 90 beats per minute, if the respiratory rate is greater than 20 breaths per minute, and if we have a white blood count that's greater than 12,000 or greater than 10% immature cells or bands. Now, SIRS is a syndrome. It's basically considered a self-defense mechanism. SIRS uses inflammation as the body's response to non-specific insults that arise from either chemical, traumatic, or infectious stimuli. And then this cascade complex is initiated. There's different stages of SIRS, stage 1, 2, and 3. Now, depending on the factors, many SIRS states actually resolve without specific intervention. However, we need to be appreciative of the signs and symptoms. This way we know how to best, healthcare knows how to best manage a patient's situation. Otherwise, major complications can arise. And we'll develop that further in class. Now, with the stages of sepsis, it would be important for us to appreciate that Hi, I'm sorry we got interrupted. So let me back up. Before we talk about the stages of sepsis, it's important for you to understand what sepsis is. So background on sepsis. Sepsis is a potentially life-threatening complication that could arise from an infection. Now, with sepsis, chemicals can be released into the bloodstream to fight the infection, that actually trigger inflammatory responses throughout the body. Now, this inflammation can actually trigger a cascade of changes, which ultimately can damage multiple organ systems and lead them to failure. And then this will lead us to, we have sepsis, and then septic shock, and then multiple organ failure. So we'll talk about this in class. Try again, read your textbook, get a basic understanding of the direction we're going in so we can develop this as nurses. Now, more to be said about septic shock. Septic shock is a type of distributive shock where we have release of bacterial toxins that act directly on blood vessels and that produce massive vasodilation and pooling of blood. Most often, it results from gram-negative septicemia. I wrote that at the bottom, gram-negative or gram-positive bacteria and even viruses. It's also important for you to know that septic shock can arise from an unknown cause as well. Now, sadly, it's common in immunocompromised people who already have illnesses and disease processes, people who are very young, people who are very old, and there's also very high mortality rates associated with septic shock. In class, I will have handouts for you that we will go through that give you more of the signs and symptoms, the assessment, and then we develop it as far as what we do as nurses. So get a background on septic shock. Now, in order for these, in order for you to do well in class, it would be essential for you to read the chapters associated with each week of instruction before coming to class. Read them, take notes, make little highlights, write down questions. Every week I will put up an introductory lecture on Blackboard for you, probably no longer than 40 minutes. That's the average attention span for something like this, 40 minutes of a pre-lecture. It gives you some kind of foundational information into the topics that we're going to develop in class. So review, listen, take notes on the lectures that I present to you before class, and then come to class prepared to discuss the therapeutic and nursing management of the illnesses and disease processes covered in that class. We have to peel apart, what do we do as nurses? How do we assess the patient? How is this illness or disease process diagnosed? And what's our role around the diagnosis and the assessment and our responsibilities? What happens medically with this patient? What happens with the pharmacology aspect? What kind of meds are associated with the treatment? And what do we need to know before we administer these medications? How do we assess if they're working, if they're the correct medications? What about nutrition? And what about the other aspects that make the patient whole, like the economic aspects, the cultural intricacies? All of these we develop in finite methods or methodologies. So be prepared. Be prepared to discuss assessment findings, nursing diagnoses, the goals and interventions, and collaborative problems. That's the direction, the focus of Nursing 213. Taking apart the content that we have identified in the curriculum, all these different diseases and illnesses, and then what do we do? Our nursing management, our nursing responsibilities to care for these individuals. So with that being said, I look forward to meeting you on Thursday. We will have a great semester together, and if you have any questions, you can always email me before class, before we see each other for our first session, or just hold on to them to our first session. I hope you have a great evening.